Welcome back to continue our discussion talking about sports injuries part 2. Joining me again is Dr. Steve Huang. He's assistant professor at the University of Oklahoma School of Community Medicine and Sports Medicine. Let's jump in.
Sure.
Now, when we left, you were talking about stress fractures, especially in relation to soccer and maybe some other sports. Clarify for us, what is a stress fracture?
Okay. A stress fracture is a process where you have what we would call microfractures in the bone. Normally, when we think of fracture, we think of a bone that's broken in half, and very obviously it's in two pieces. A stress fracture really is more of inflammation in the bone, causing microfractures that can lead to a full fracture, but we don't see it on an X-ray as a complete fracture at the moment.
Okay, so it's just little bitty fractures throughout the bone.
Correct.
Now, does this present in terms of symptoms? Does a person know by symptoms something?
Yes. Typically, the history is that of overuse. Okay, so we see them in places such as the foot, the shin, in runners or in someone who does a lot of pounding on their feet. And the symptoms that will occur will be pain, possibly swelling, but it may not be quite as bad as a complete fracture.
Okay, so the person would begin to notice some pain or swelling and
Yes.
discomfort in that particular area. Now, some people may want to know, could this be related to, because we hear a lot about calcium and vitamin D in relation to bone health. Could this be related to a person that's not getting adequate calcium and vitamin D for the bone strength, or is it not related to that?
It definitely is related, although it does not have to be pathologically related. In other words, for someone who is very thin, they will be at higher risk for stress fractures or any kind of fracture. But because you have a stress fracture doesn't mean that you've done something wrong or that you have a problem with your bone. In other words, it could be more overuse. Typically, it's overuse. Someone who's running or jumping more than their body can take.
Okay, but the vitamins D and calcium, it doesn't hurt for bone health. You're going to need that.
It's always very important, and the truth is, once you have a fracture, calcium and vitamin D are very important building blocks so that your bones can repair themselves. And additionally, when you do have stress fractures, it's also very important for the healing process too.
Okay, now, and with stress fractures, you can get this at any age because, of course, we have young kids who are starting off playing soccer or different things, when they're 3 and 4 and all the way up. I mean, so can you see it in very, very young children?
Typically, we don't see it that much in young children.
Okay.
Usually it is the age of late teens, early 20s, especially those who are trying to stay very fit and who do lots of exercise all the time without giving themselves a rest.
Okay, so the concept, sometimes parents will do that, have their child go from sport to sport to sport to sport. That's not a good thing. It sounds like there needs to be some rest, some downtime in that.
Yeah, I think we've become a society of specialization in that, now it's not unusual to have someone play soccer year-round, whereas before, they may change from baseball to soccer to football. Nowadays, some play sports year-round in the same sport, and that's not necessarily a good thing because it increases our risk for overuse type of injuries.
Okay, so the same thing whether you're playing the singular sport all year or you're doing several sports all year, the body needs to have a rest.
Absolutely.
Okay. Now, when we think then about soccer, tell me in terms of, you can head the ball, to me that always seemed like such a dangerous move. I mean, but tell me from your perspective as a physician, is it, and what kind of injuries could be sustained from that?
Sure. Heading the ball is definitely a dangerous move, and we do see injuries from it. Typically, concussions are very common, and that's why really I think it's 10 years old where's the cutoff. So if you're younger than 10, it's not recommended that you attempt to head the ball. Whereas as you get older, your head, your neck is a little bit stronger, and it is allowed in the sport. Concussions can be very dangerous in football, soccer, any sport, because it's basically a mild traumatic brain injury, and it does take a while to recover. Other things that we can see are neck injuries. You can see eye injuries and other things, but those are going to be less common, of course.
Now, with a concussion, because you talked about that in terms of, mild brain injuries, what are some of the signs or symptoms a person would have who's had a concussion? Because could you have a concussion and not know it?
Many of us experience concussions, and either we deny it or we don't know it.
Okay.
It can be very mild symptoms such as headache, nausea, visual changes or blurred vision, and typically they're transient, they go away fairly quickly. But it doesn't mean that there isn't an injury, and we more or less think of a concussion as a contusion or a bruise to the brain. And you don't see that on your skin, doesn't turn black and blue. Nevertheless, you do have an injury to a very important organ.
Could you also have some problems with balance?
Absolutely, absolutely, and that's why there are mechanisms to test folks. There's something called a SCAT card, or I can't remember what the SCAT stands for, but there's a series of questions that you ask the patient. Do you have any headache, nausea, visual changes, and it goes through a whole bunch of different types of symptoms.
So when kids or youth or whomever are doing frequent headers, would this be something that's good periodically to try to determine how are they really doing?
That's a good question. I don't know that there's any specific recommendations for screening for concussions. Typically we're more reactive than proactive there. There are new types of technology where we test people at baseline, and it's called neuropsych testing, and it's a series of questions and reactions while you're on a computer program to see what your baseline is, and then when they think you've got a concussion, you take the test again, and they see as your reaction speed and timing changed, how are you compared to your baseline.
Okay, and that can be important because tell me a little bit about, and our viewers here, about making sure someone knows what day of the week it is and what time it is. I mean, when are questions such as that appropriate if a person's playing a sport and appears to have an injury? When could you ask those kinds of questions?
Absolutely. If someone has a head injury at a game, or if you're on the sideline and someone heads the ball and comes off the field and they're looking like they're not themselves, you want to ask them those particular things. What's your name? What's your address? What's your phone number? Do you know what day of the week it is? Do you know where you are? Do you know what the score is? What part of the game is it? If it's baseball, is it the 9th inning or is it the 1st inning? And all those are very important indications as to whether or not the person is at their baseline.
Okay, well, we're going to take another quick break, doctor, and come back and talk about a couple of other sports. Okay, please stay with us. We'll be right back.